wait for about some minutes because, Thomas, if you don't know this, here in Greece, we're not very on time. So I think more people will come soon. So in order not to lose any point, I think like 5 minutes we can wait.
All right, definitely. Okay.
So hello everyone. I would like to welcome you to this webinar. My name is Maria Saha. I'm in my 5th year at the Medical School of Patras and HelMSIC's National Officer of Medical Education. The Standing Committee on Medical Education, or SCOM in short, is one of the 6 standing committees HelMSIC has. It holds many programs like Hard Skills Academy and Summer School and aims to help future physicians become as qualified as possible. That's why we collaborate with Amboss. HelMSIC and Amboss collaborated a few years ago as well, but this year our partnership resurfaced at the AMSE conference in Thessaloniki, where Thomas, who is the coordinator of this webinar, and I first met. So I won't babble more. Thomas, the floor is yours and we can hear you.
All right. Thank you so much, Maria. And hello, everyone. First of all, I hope that you don't mind. I would like to record this webinar for some people that were not able to join, but perhaps would like to revisit some of the stuff that I'm going to talk about. As Maria mentioned, my name is Thomas. I'm a medical doctor from Slovakia, and I was actually also an active member, not of HelMSIC, but of IFMSA. 4 years ago, I was the SCOMI director in IFMSA, and that's also what brought me a little bit towards, working with Amboss and sort of keeping the SCOMI life also in my professional life and work. And if you'll just let me share my screen very quickly. Today, I will be talking a little bit more about the platform of Amboss itself, and at the end, I will give you a couple of tips that you might find useful of how to use the platform, as well as how to use other tools that are add-ons of the Amboss platform. And before I do so, I would like to thank Maria and HelMSIC for letting us host these webinars to sort of bring this information and Amboss closer to you. In the meantime, in the chat, I have put a link for a group discount sign up. I will mention a little bit more at the end, but if you would like to, sign your name and email, and you will be able to get Amboss with a pretty good discount, but I'll mention more towards the end. So throughout the webinar, I'll briefly mention why using Amboss as a digital medical education partner in your med school and in your studies is a sort of a good idea and a good way to utilize both digital medical education and some educational strategies that I'm sure you also know from SCOMI, such as problem-based learning. Then we'll do a short platform tour because I see some of you, and please feel free to still introduce yourself in the chat, are from the 1st and 3rd year of med school. But just to let you know, Amboss is relevant for every single medical student as well as junior doctors. So I'm sure if those who are almost finishing your med school, if you're in the 6th year or in the 5th year, you might find Amboss useful even after you graduate. And at the end, as I mentioned, I will mention a little bit more about how you can get a group discount, as well as some information about my colleagues who are actually coming to Greece in March. So you could visit them and use the opportunity to get some Amboss swags or to talk to some of the people that work at Amboss. So to begin with, on this slide on the left hand, I think we see this common learning pathway that is quite common for every single medical student everywhere in the world. It was quite common for us in Slovakia as well. So, you have a bunch of resources that you study from, your books, PDFs, presentations shared by tutors. Many students, like myself, back at the time, I used to take a lot of notes and also review some flashcards. And this is what I want to also focus on a little bit, because I will share with you, if you are using Anki, there are some quite cool add-ons of Amboss for the Anki flashcard software. And obviously after that, you would have your one-on-ones with tutors, if that's a possibility. And many times students from different medical education systems, they try to review question banks or Q banks, as we call them, which are essentially, it's a bank of clinical cases. And this is where Amboss also comes in handy. And, if you were to follow this sort of process one by one, obviously with all of this bunch of resources, this would leave you quite confused. And this is where the Amboss comes in quite handy, because it tries to take all of these and unify this under one roof, let's say. So as soon as you set your goal or learning objective, you can start utilizing Amboss from the knowledge-based perspective as well as practice-based. And I'll show you in a bit what I mean by that. Just a little bit of background about Amboss itself. So you also know, whose platform you're using and whose platform you're trusting. Basically, Amboss was built by doctors for doctors to empower you to provide the best possible care. And this is true. Here, for example, this gentleman, his name is Majid. He's a doctor from Germany, and he's the CEO of Amboss, which was a project in 2012 in Germany, developed by last year medical students to help them pass their final exams. But it was quite successful project that, eventually it became a company. 1 year after Amboss was created, it was so popular that 98% of German medical students have been using that to prepare for their finals. And a couple of years after that, it was so popular that students from outside of Germany used to translate it from German to their own local language. But good thing is that, today we have the platform also in English. And I'll also show you some cool features which you can use to translate it to your local language. But basically, the story goes that in 2012, it was a startup in Germany. It was so popular that in 2017, they created an office in New York for the American market, where the US medical students, they use it to prepare for the USMLE as well. And in 2008, the platform and the English platform was so good that we expanded towards the rest of the world. And that's also why I can introduce Amboss to US Greek medical students. When it comes to the platform itself, and right away I'll go to it and show you all of that so that I'm explaining right now. It has three main features, and the first one is the library, which is basically your knowledge base from A to Z of medicine, from the first to last year of med school, as well as your first steps in residency. Then the question bank, which is, in my personal opinion, even better part of Amboss, because it tests you from all of this theoretical knowledge in clinical cases. I know that many students do not utilize this as much, but my personal advice is that even if your medical education system doesn't use clinical cases in your education, you should do it on your own free time, because it's really amazing way how to study medicine. I think it should be mandatory for all medical schools to follow the problem-based learning educational strategies. However, even if not, for sure you can utilize Amboss on your own. And lastly, there is this analysis, which is sort of a fine-tuning of your learning. You will be able to analyze where you performed well, as well as where you performed not so well, so you can target those areas. Before we go into the platform, if you do not have an Amboss account, you can register at any time using this 5-day free trial. I'll keep this out for 2 seconds so you can scan it if you want. Then you can start exploring Amboss as I go with the platform tour. So, okay, 5 more seconds. 5, 4, 3, 2, 1. And now I can show you the platform itself. So this is how it looks like. First of all, Amboss can be found also in an app. So if you have a Android phone, or if you have an iPhone, you can find Amboss as an app, both the knowledge part and the question bank. But me personally, I like to use Amboss as this dashboard when you just log in on amboss.com. And this is how it looks like when you first join. Definitely, once you're creating your account, very briefly, and I have to mention this, it will ask you a couple of questions, especially if you're a medical student or a doctor. When are you graduating and which country you're from, and also which medical school you're from. So I would really, give you an advice to select your country as well as your year, because this is important information. Also, when, for example, you would request Amboss informations like how many students in Greece are using this platform and if it's good, right? If students studying at Patras, for example, or Athens, if they trust Amboss. Also, definitely select your main reason to use Amboss, whether it is general medical studies in Greece, whether you are studying for any other national exam or USMLE, for example, or the iPhone. Do that. So, for example, if you select the general medical studies in Greece, then if you are first to third year of med school, I suppose that you could select the basic sciences exam. If you are 3, 4, 5, 6, you could do the clinical sciences exam. And save these changes. And why I'm mentioning this is that Amboss will take a look at these, and it will also edit a little bit the knowledge part or the library to answer your current learning objective. But anyway, if you log in, if this is the stuff that you have already done, you will be shown this dashboard where you will see the most important information and your, let's say, latest study sessions, as well as your overall performance. And please do not judge this. I promise I use this account only for demonstration purposes. I would hope that my answers would be better than 25%, but you never know because I have finished med school 2 years ago. But anyway, when it comes to the 3 main features of Amboss, you can see them on this left-hand side on this panel. So the first one is the library. And as you can see, there are some articles, videos, and media library. Personally, I think that the articles are the most important part where you are going to benefit from. And let me just show you a random article. So at the beginning, you will find this distinction into basic sciences. So here you will find your anatomy, your histology, your biochem, biophysics, etc. In the clinical knowledge, you will find your clinical sciences, your systems, your disciplines, etc. So let's take a look at a clinical science article, and I think that it might not be relevant for every single one of you right now, because I saw that some of you are from the first and third year, but don't worry, you can definitely go into the basic sciences part and explore an article. So let's say internal medicine, let's say pulmonology or pneumology or however you call it in your local language. And for example, infectious lung diseases. And when you have stumbled across this emoji of article, you know that you have finally reached an article. So let's take a look at pneumonia. Pretty common, and also, it's already February, but this November and December were quite the time of the year for pneumonia. So this is how the article looks like. Well, first thing that I want you to show is that it was last edited on January 22nd, so exactly 1 month ago. And you know that this resource is going to be very up to date. If we click on this content policy, and you can do it on your own, you will see how the content in Amboss is created. But to summarize it, we have around 150 full-time physicians working in our editorial team who are creating this content. So it's not just me, copy pasting this from Wikipedia or from Google into Amboss, but we have a team of physicians that use all of these resources, which you can check as references, to create this one article, right? So if we expand it, obviously there's going to be text. We can't create an article without writing, because this is the easiest and the most common way how medical students learn. However, all this text is defined and it's written in a way that it's supposed to be very, straightforward and also very good. So it's not going to leave information out of the article just so it's straightforward, but also it's not going to be very, nitty-gritty going into the details of everything in like one text. I can see, there is a lot of medical terminology underlined, and this is if you, for example, hover above it and click on it, you will see the definition from Amboss. You can also click on the article, it will open it in a split view. So you don't have to click here, Google stuff. If you just quickly want to know, okay, typical pneumonia, what is it? I've heard it. Okay, you can just quickly, see the definition. Also, there is a bunch of tables and mnemonics. Even these tables are designed in a fun way. So if you're using active recall, thinking about what are the common pathogens between community-acquired pneumonia and hospital-acquired. Okay, I went through it. Then you can just click on it and it will blur and unblur. So it's a little bit more interactive than just giving you a simple table. On another hand, we have a lot of mnemonics. And I know that for international students, and this I also had an issue with, learning with English mnemonics was sometimes tricky for me, but it was still a good way how to remember some stuff. And when we scroll down, you have all of that I mentioned. So risk factors, it's going to be in bullet points because this is honestly how every single medical student studies these days. We don't want sentences, we don't want phrases, we want bullet points, so everything gets straight to the point. Again, you see that you have a bunch of stuff underlined. Amiodarone, bleomycin, okay, I heard about it, what is it? You have these definitions here. If we move down, let's say to the pathology, you would have a lot of visuals that are also helpful. And we also encourage students to, take a screenshot of this and put it in your notes if you are taking notes on your iPad, or, if you are making a document with that's, for example, preparing you for exams. Definitely, we encourage you to take leverage of this. Also, this is a little bit far-fetched, but obviously, medical school is supposed to teach you how to look for information and how to look for joining your preclinical or theoretical knowledge with the clinical one in order to help you with a good clinical decision making, right? So I'm sure that you had lobar pneumonia at pathology, you have looked into the microscope, but sometimes, for example, when you reach the internal medicine clinic in the 5th year, if you go to pneumology ward, you might not remember that you even, screened the pneumonia slide in the microscope. But Amboss, it tries to also focus on, bringing all the knowledge for you to understand the clinical relevance. And good thing is that you can still use this Smart Zoom tool. So this is like a online microscope, let's say, with some definitions. So I'll give you a chance to define what this black thing on lungs is. I'm not, obviously you don't need to write this into the chat, you can just answer it for yourself. It's one of the most common pathology, and it's not even that much of a pathology because every single pathologist will see it, and it's anthracosis. But anyway, if we move on, all of these slides, there is a bunch of resources and slide boxes in Amboss, both with physiological, so histology slide boxes as well as pathology slide boxes. And you can just search here. Oh, excuse me. Okay, I misclicked. So you can just search in the search box here, for example, pathology slide box. And it's lagging a little bit. And it should find a virtual histopathology slide box, for example, here. And here you will find all of your, tissues. In this case, we have the pathology slide box, but we also have histology slide box. So if you are still, in your 1st and 2nd year of med school, this is what you will find definitely relevant. And here you have all your physiological. So for example, jejunum. So if we, and you can also use the smart zoom in all of those. So this is quite handy. Also, if you are still in first year, since I know a couple of you are, there is a 3D anatomy that you can search for. And here you will find majority of the tools that you need. So for example, skull, I know that this is neuroanatomy, so that's maybe second year of med school. I don't know how it works in Greece. But it will open a software inside Amboss that will give you your 3D anatomy models with some definitions as well. It's going to take a little bit more time to load because it's opening a different software within Amboss. So maybe just for the sake of the time, you can just search for it yourself because it's lagging for whatever reason. Maybe it's because also that I'm streaming. But anyway, if we go back to the pneumonia article, because I want to show you the cool stuff for the clinical decision making. If we expand it and scroll a little bit down, there is a lot of focus on the clinics, obviously, because this is a clinical sciences article. So, in pneumonia, one of the main diagnostic tool besides physical examination would be chest X-ray. For many students that have already been through radiology and pneumology or internal medicine in general, you could spot what's wrong with this chest X-ray, or you could spot the diagnosis right away. You can also use this caption here to read about it. So it's right upper lobe pneumonia. Okay, so I know this is the right side, here is upper lobe. So I'm looking for something in this portion. And okay, I see that here is something that's probably not supposed to be here. If that's, not the case for you, you can click on the overlay and Amboss is going to highlight it for you. So it's easier, to spot and to get it into your eyes. And this is for every single X-ray, for every single diagnostic tool. Imaging diagnostic tool. And as you can see, there is a bunch of those only for pneumonia. If we scroll a little bit down here, we have chest CT. And cool thing that I wish that I had when I was studying medicine is this scrollable CT. So this is as your Tomocon software that I'm sure that many of you already had experience in hospitals. But good thing is also that this one has an overlay, so you can already see what you're looking for on the chest X-ray. So there's some consolidation of the pneumonia. And this is, since we are looking from below, this is the left lung. And this is the back portion. We can see the heart here, the spine here, etc. And you can play around with it. You can change the saturation. You can also measure. So this is, to give you some of the competencies of the radiologist or of a clinician that would use CT for the diagnosis. Moving on, also to support your clinical decision-making, again, there are many calculators that are making physicians' life easier, obviously, to give you the algorithm for whatever, right? So for example, here we have KERP 65, and if you have been through pneumology, maybe you know that this is a score for determining whether the patient is to be hospitalized or is to be released home with pneumonia. And you can click on it and it's going to open this calculator with a couple of questions. So is the patient confused? Well, let's say yes. What's the urea level? Let's say below 7. What's the respiratory rate? Let's say above 30. Is the systolic BP below 90 or diastolic below? Well, let's say no. What's the age? It's an elderly patient. Okay, the KERP score is 3. What's the 30-day mortality? 17%. Suggested triage, inpatient, possible intensive care unit. So we should definitely admit this patient. And there's a bunch of these kind of calculators, as well as these algorithms for treatment, for management, for diagnosis, and for care. Okay, I'm not going to go through the rest of this because I think that you got the gist of how to use these articles. Maybe at the at the beginning, if you click on the high yield, as you can see, it's going to compact the article a little bit to give you only the most high yield and relevant information. This is the standard, which I've shown you. And if you click on the clinician, it's going to give you a little bit more information. So for example, if we go here to treatment, you can see that it's in dark blue. it wasn't here before. And this is for if you are, in your first years of residency. Also, what's cool with all of the drugs, it's going to give you the dosage, which I think that many times, even in med school, you don't want to give this sort of information to students because it might be too overwhelming. And obviously, we have also postgraduate education, and Amboss will give you all of these dosages for that. Lastly, if you click on the key exam information, and if you remember at the beginning, I told you to select the learning objective based on what you're learning for, and it's going to highlight the part that would be relevant for your exam. As well as once you go to the question bank, and if you answer any questions regarding pneumonia, it will underline it. As you can see, there is a slight underline. It's in red, but since it's together with yellow, now it's orange. So if I answered incorrectly, it's going to underline the parts in Amboss for me to focus on. So this is brilliant, right? So before, I had a question, probably I was showing someone Amboss, and I had a question about some treatment, and it asked me about fluoroquinolones, and I answered incorrectly. So Amboss remembers and it underlines it. So this is brilliant way how to, study, because you have everything in one place. Also, you can take, highlight. Currently, it's only in blue. I can't tell you why they didn't include other colors yet, but I'm sure that they will include it. So if you if you want to distinguish your highlights, I'm sure you will be able to do it. And I mentioned to you that you will be able to translate it. I'm not sure if Greek is here already or not, but I can just show you, for example, Arabic as an example. It's going to automatically translate it. So this is automated translation, and there is a disclaimer at the beginning that will tell you it's an automated translation. But still, you can. So see, now it's in Arabic. I don't speak Arabic, so I can't say what's the correct ratio of the translation. But anyway, we try to support students if English might not be, the first choice, just to give you a little bit more space with customization with your local language. But still, let's say you want to translate this into Greek, you just click here, with Google Translation as an add-on, you can still do it this way. So this has been the articles, and there is a bunch of other stuff that I could show you inside them, but I'm sure that you will be able to do it on your own. I want to now focus a little bit more on the questions and the cases. So there are a couple of ways how you can utilize the questions. First, you can go directly from the article into the question bank session, but one thing is that all of these questions are going to be about pneumonia, right? So it's not so exciting, but still, if you just want to go through these questions because you have went through the article, let's just select one question. So all of the cases are clinical cases. So you're going to have a patient, right? You will have a patient, a little bit more information about their history, the progression of their disease, or any relevant information. Also, here we have some info about the physical, so temperature, pulse, respirations, blood pressure, etc. We also have some labs in this case, and it's always going to end with a lead-in question. So in this case, which of the following is the most likely causal organism? So, it is asking about causal organisms, so it's a little bit more about, let's say, microbiology, but still, the case is about pneumology, right? I'm not going to go through it because, it's fairly long and also with the analysis, but you can select your own or, feel free to go through it if you want. But let's say that I'm ready to answer. Okay, based on these, I would say blah, 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 Staphylococcus aureus. Okay, well, it's not the correct answer, but what's good, and as you can see, Amboss didn't tell me what the correct answer is because it wants me to try again. Also, it will tell me why this answer is incorrect. So Staph aureus is only the third most common cause of community-acquired pneumonia. Oh, so now I know it's community-acquired pneumonia. Okay, what's there in hospital that might be more common? Well, let's say Legionella. Okay, no. Let's say Aspergillus. Okay, it's not a fungi. Pneumocystis, this is for immunocompromise. Is Streptococcus pneumoniae. So it's the most common cause of community-acquired, oh, it's community, sorry, I thought it was hospital, of community-acquired bacterial pneumonia. It will tell you why this is the correct answer, as well as now, cool thing, if you click here, it's going to open in a split view the pneumonia article, and it will highlight the part that is relevant to this clinical case. So, you know, normally you would go through your case, you would try to answer it, and then you would go through your notes or to the PDF. But if you just, with one click, Amboss is going to give you the theoretical or the knowledge-based relevance towards these practical ones. So this is really cool. Now, you know, you would go to a next question, obviously, but here I went to analysis. Okay, 0 correct because we only had one question. But, you know, you just get the gist of it, how this works. So this is one way how you can access the questions, but more, and I personally think that you could use or utilize the QBank option better. And let's just select new custom session. And here, let's say that you are studying for, let's say, clinical shelf exam from medicine. I'm going to click on this. Systems, okay, I'm only studying for the cardiovascular system, and I want discipline, family medicine, internal medicine, obviously, and let's leave the radiology one. You can select questions with images only. I'm just going to deselect this, and you can see that there is 253 clinical cases that are relevant to these parts that I selected. In total, we have more than 9,500 clinical cases in Amboss, which is really, really vast. You know, it's a lot of questions. Let me just show you, okay, now if the filter is really right. So we have a 54-year-old woman that comes to the physician because of 6-month history of dull, persistent pain and swelling on her right leg. Okay, this might be relevant for internal medicine as we selected. The pain is worse at the end of the day and it's relieved by walking or elevating her feet. 2 years ago, she developed acute deep vein thrombosis in her right calf after a long flight, which was treated with anticoagulants for 6 months. Physical shows 2+ pitting edema of her right leg. The skin around the right ankle shows a reddish-brown discoloration and multiple telangiectasias. She has dilated varicose veins in the right leg. Which of the following is most likely to establish the diagnosis? So usually, and this is a tip that people agree on, first, whenever you stumble across clinical case, read this part first, because this is going to give you it's going to guide you on what you should focus on here. So which of the following is most likely to establish the diagnosis? Okay, so we know that this is a patient that probably has DVT. Okay, is it going to be duplex sonography, ankle brachial pressure index, D-dimer assay, nerve conduction studies, or CT with most contracts? I would personally say it's duplex. Okay, this is the correct answer. This was a fairly easy case, I think, but many of you might say it's D-dimer because okay, this I know that it's something with the blood coagulation, but I think if we click on it, it's also going to tell us that it's more common for pulmonary embolism. But yes, negative results effectively rules out. So if it's negative results, but anyway, just to show you, if we answered correctly on the first try, it's going to show us in the green. It will also, underline the most relevant parts. If we reset the question now, let's say that, you see it for the first time and you don't know how to answer. You can click on the key info and it's going to underline what's the most clinical relevant. So pain is worse at the end of the day, edema, skin around the right ankle, dilated varicose veins. All right, might guide me a little bit. If you still don't know, you can click on the attending tip. And this is going to tell you this patient's unilateral chronic dull pain, edema, dilated veins, and in the lower extremity, and history of DVT suggests chronic venous insufficiency. And how you're going to, diagnose this? Well, then you can select. And we know that it's duplex, but now it's in yellow or orange because we use these hints. after that, you would go to the next question. Okay, maybe we can go through it. We have a couple more minutes. A 40-year-old woman comes to the physician because of 6-month history of recurrent episodes of chest pain, racing pulse, dizziness, and difficulty breathing. The episodes last up to several minutes. She also reports urinary urgency and 2 episodes of loss of consciousness followed by spontaneous recovery. There is no personal or family history of serious illness. She does not smoke or drink alcohol. Vitals are within normal limits. Cardiopulmonary examination shows no abnormalities. Holter monitoring is performed. ECG recordings during episodes of tachycardia shows QRS duration of 100 milliseconds, regular RR, and absent P waves. Which of the following is most likely underlying cause of this patient's condition? So, we have how many? We have 6 options. So it's macro reentrant rhythm in the right atrium through cavo-tricuspid isthmus, AV node with slow and fast pathway, pre-excitation of ventricles, fibrosis of the sinoatrial node and surrounding myocardium, mutations in genes that code for myocyte ion channels, bursts of electrical activity from automatic foci near the pulmonary veins. Well, I think that this one is a little bit more tricky, right? Because obviously in your cardiology rotation, you would learn of all the different causes and all the different arrhythmias, but it will never, or at least for my case, we never learned with this way. Okay, you have a patient, what's wrong with her? You have these 6 options. So let's use the key info now. So episode of chest pain, racing pulse, dizziness, okay. 2 episode of loss of consciousness, very serious. QRS duration of 100 milliseconds, regular, and absent P waves. Well, this gives us probably the most information, but let's click on the attending tip now. This patient's symptoms together with the ECG findings suggest paroxysmal supraventricular tachycardia, which is the most commonly caused by atrioventricular nodal reentrant tachycardia. Now, we need to know how is this relevant to these answers. So let's say pre-excitation of the ventricles? No. No? Okay, it's AV node with slow and fast pathway. I know that this might be tricky for especially the junior students here, but for sure, some of these you will learn either in pathophysiology, perhaps, because that's where you learn the conduction systems issues of heart, or during your cardiology in 3rd or 4th year. But please don't mind this. If you don't understand yet, it's completely fine. Definitely, what's also good is that if you remember how I customized the QBank, you can customize it even for basic sciences. So if you want to learn microbiology, biochemistry, anatomy, you can do all of that. So it's not only clinical. And now if we go to analysis, it's going to show us, I think, 50%. Yes. So, this is also what you can utilize. So this is the second feature of Amboss. And now, without further ado, what's the last one is the analysis, right? So here you will see your whole study summary. So in total, I showed 220 questions, not to you right now, but in general, since I'm doing this platform tours, 28% correct, 2nd percentile, average time per question is 1 minute 16, and total time spent. This is also quite nice information, especially if you are taking an exam and okay, I have only 2 hours for these exams. So, answering these clinical vignettes is something that you can learn by doing it. So even if you don't know how to do it from the beginning, which was the case for me, and it still is in many of these questions, because I did not have this sort of education during my med school. But the more questions you answer, the better you get at it. You can also have session analysis, so see all of these different sessions that you had. And for those that are studying for the steps, you can also have USMLE step predictor, but this is something that you can explore on your own. Lastly, before moving to the other information, we have a couple of study plans that you can already use. Recently, we have shared, actually, I was working on this 100-day clinical science study plan, which gives you 100 days for all of the clinical sciences that you will need, either as a 5th or 6th year med student. Obviously, you don't need to go through all of those, only through the relevant ones. At the end, you will have your revisions as well as exam simulation. So this is quite good. But for example, If you are studying for iPhone, this one is not yet released. I just have it here because I've been working on that. You will be able to use an iPhone study plan. If you're studying for the steps, you can use the steps. Or if you're studying for your shelf exam, so surgery, for example, you can see this week, couple of weeks long study plans for surgery. So you can also create your own study plan. So, put how much time you need, which topics you need, etc. So there is a lot of cool features, how you can, learn with Amboss through answering questions, as I have just shown you. But again, just feel free to do this on your own time, because I would be going for 5 hours. So this is Amboss as itself. Now I would very quickly, you can see that I have a couple of tabs open here. I want to show you some of the cool features that we added recently and that, our team is adding day by day. So I know that ChatGPT is really, really used. I could probably not work without ChatGPT these days. As you can see, like I have been, asking it stuff about this MCCQs and exam in Canada. And then I also use it for some Google Sheets formulas, because who's bothered to Google these days this stuff when you can just ask ChatGPT. But anyway, I want to show you that there is something called Amboss GPT, where, again, if you are going to ask it a question, it's not going to go online. It's going to the Amboss articles, which you already know that are, peer-reviewed by physicians from all of these clinically relevant articles. So it's going to go there to search for this knowledge. And, you can ask it anything, whether you are studying. Obviously, note, I do not offer tailored medical advice. Always consult specialists. This is not supposed to, if you are a GP or family medicine doctors, to ask it, okay, I have a patient with this and that, what could be the stuff? Because that's, we cannot say that we can replace a doctor. But it's going to give you quite good answers. And again, it's going to search for Amboss. If you want to, this is completely for free as long as you have Amboss. So let's say we have some probes here. So I'm just going to use that. Differentiate transient ischemic attack from stroke. You need to sign it with, and yeah, it's loading. Okay, let me, so that I show it to you, not only talk about it. Okay, I'm connected, and now it's going to, go to Amboss. Yes, allow. And this one is very simple, right? It's a very simple probe, but it's going to give you an answer as normal ChatGPT would, but it's going to go, and as you can see at the end, transient ischemic attack, it will attach the article from Amboss. You can click on it and open it, which is pretty cool. So this is if you want to activate it, you click here on Explore GPTs, and you just do Amboss, and it's going to give you the option. So it's free to utilize as long as you have ChatGPT, which is free, and as long as you have Amboss account. Well, it's taking some more time, but see, it's here. Okay, so this is the first cool feature. Secondly, for those that are using Anki, and I hope that there are some of you that are using Anki, because it's by surprise, it's not very popular in Slovakia. I don't know why yet. So, it's a flashcard software. You can already use pre-made flashcards, or you can use, your own. You can create your own. There are some add-ons that you can activate. And if you go to this website, I'm going to put this in chat. It's going to tell you how you can put this add-on into Anki. And as you can see, what it's going to do, every single medical terminology that you will have in your Anki flashcard, it will do the same as it is in the Amboss article. So it's going to underline it, and it's going to give you the definition within the Anki software. And when you click on it, it will also open an article within the Anki software. So that's really cool if you're especially like someone heavy on Ankis. Same thing is Amboss Chrome browser extension. So let's say we go to PubMed, and you can see I have this activated here. This is the Chrome browser extension. I just open a random article, but let me show you that this is not like pre-selected article. If we go to PubMed, any random articles, it's going to underline the medical terminology that's relevant, and it will give you the definition. Again, same as in Amboss. You can also click on it, open. So for example, open a Amboss article, etc. Right? So that's pretty cool. What I can tell you now, we are also working for something offline. So if you have any PDF or if you have a presentation in PDF, it's also going to do the same. So it's going to underline the medical terminology offline, so you don't have to be on the web. So that's pretty cool. And there is a bunch of stuff that we are exploring right now, such as the AI integration a little bit more. Maybe you have seen in some of the articles. Let me just show you. Okay, let's go to the pneumonia again. Here, but it's still a beta version. It's not yet released. We have MediCoach, and this is supposedly going to prepare you for your oral exams. But for now, we don't have a microphone sort of integration, but you're able to, to type. So welcome to the examination. I hope you feel well prepared. Mrs. B has developed a lung abscess. Could you tell me which antibiotic combination you would choose for the empirical treatment of an abscessing pneumonia? And then you can put, your answers. I don't know, fluoroquinolone. Okay, let's see. Can be part of the treatment, but they are not typically the first choice of abscessing pneumonia. Can you think of a combination that covers both gram-positive and gram? Okay, no, I'm gonna tell it I can't. Okay, in such cases, the current S3 guidelines recommend a combination of cephalosporins and clindamycin. So, you can use this to prepare yourself. It's still in beta version, so, I'm like not saying use this because I don't think that you will have access to it in your Amboss accounts, but it's something that we are preparing. So if you have any questions now, I would be more than happy to answer those. But before I do so, as I told you, there's something that we want to do for the Greek medical students in terms of getting access that is cheaper than the normal price. And we have this group discount sign up. I wanted to put it into the chat. So if you'll allow me very quickly, I'll just stop sharing the screen so I can find the link. It's here. So in the meantime, what do we mean by the group discount is that if you sign up, it doesn't mean you have to buy. It's not, let me just share the screen again. It doesn't mean that you have to buy Amboss with the discount. It just means that you are opening it for other students that might buy it. And if 20 plus students sign up, the discount is 25% off from the yearly membership, the student life, which is access until the end of med school and first year of residency, and the CubeMed add-ons. And if 50 students sign up, it's the same for the yearly membership and student life, but 40% off from the CubeMed add-ons. And as I said, signing up doesn't mean that you need to purchase. You are just increasing chances for a higher discount. So if you want, there's 30 people here. You will already reach the 25% discount. And if you want to share it with your classmates, so you can reach the 50 ones, so the discount of the CubeMed add-ons is higher, that would be perfect. Once you either reach the higher discount, or in a couple of days, we'll close this sign up and then we'll share the shop with the already applied discount with everyone that applied. And I will also share it with Maria, so you can share it with all students in Greece, because this is not only for people that are here in the webinar or for the people that sign up. It's everyone is eligible to buy it with the discount. And lastly, as I mentioned to you, my colleagues are coming to Greece and they asked me if I could mention this. So on 12th of March at 2 p.m., they will be at the University of Patras, and between the 14th and 18th of March, and I know Maria is still discussing with them, they're going to be present at the University of Athens, and they will do a similar workshop like this one, probably with a different scope. But if you are free, or if you know some of your classmates that would be free, just go there. I'm sure they're bringing some swags and goodies, so just go grab the tote bags and the stickers and the pens. And obviously, probably they're also going to offer a similar group discount. So now I'll finally stop talking, and I'm going to go to the Q&A part. So can you still receive the group discount if you have an already existing account with a subscription? That's a very good question, Katerina. You can, but only if you purchased Amboss in the last 30 days. So let's say, because we have a 30-day return policy. So if someone bought Amboss with the full price last week or yesterday, you can email our customer success team. They will cancel that. They will return you your money, and you can buy it with the discount. Or another option is if your discount is, and if your current access is ending in the next 15 days, so let's say it's ending in 10 days, even after we close the group discount, we are able to reopen it up until 15 days. So if you bought it, let's say 3 months ago, and it's for 1 year, unfortunately, you won't be able to buy it, let's say, for the next year. But I'm sure that there will be many, many more opportunities to get very similar group discount, if not the same, in the future. As I mentioned, my colleagues are going to these two universities, and they will probably, if there is a lot of students, at least 20, even in 2 or 3 or 6 months from your university or class that would want a group discount, you can still reach out to us and ask for one. Will you visit Ioannina as well? Not as far as I know for this part, but in the future, if you would be interested to host us and to host a workshop, I'm sure that my colleagues would be able. Katerina is asking about Thessaloniki. No, for this moment, it's only Athens and Patras, but we actually have been to Thessaloniki, as Maria mentioned, last year. And what's interesting in Thessaloniki, you also have a couple of Amboss accesses bought by your medical school, and they have been giving them to the students. So I don't know how the situation is, honestly, with giving away these codes, but I would reach out to probably your medical library if you're interested for access that has been purchased by your medical school. Alexandros, I have 2 questions. First of all, in which field do you think that Amboss outdoes other study tools such as Osmosis, UWorld, Patoma, and others? And why should they register for this platform? Brilliant question. Well, first of all, we are not saying that, you should, or that we are better than these competitors. We think that we are, but we don't want to say, okay, use Amboss instead of this. I think that, for example, Osmosis has a little bit different scope. So they are doing these educational videos with a little bit of, let's say, articles and a little bit of questions. UWorld is very good at the QBank part, where they are preparing, for example, in majority for the USMLE, but they are lacking on the articles part for the moment, right? So, you could combine all of these. When it comes to Patoma, these are educational videos and the book, right? So obviously, I love Patoma myself. I have watched many, many videos. So what we would recommend is to use a combination that you trust the most, right? Whether you are preparing for the steps or for whatever exam, I'm sure that you can find a combination. So for me, I can just give you an example. I'm preparing for the steps, and I'm studying from Boards and Beyond, Patoma, and for the question bank, I use Amboss, because as you will find out, the question bank is very, very thorough. And it's a brilliant way how to learn by solving questions, because there is so much learning encompassed in those. But again, this is up to how, what sort of combination of the different tools you're going to use. Regarding my previous question, as far as I understand, if the subscription is monthly, I could still get the yearly discounted. Yes. So if you bought only for 1 month and it's going to end sometime in March, just let us know when. You can feel free to send me an email at tps@amboss, and I'll get you in touch with our customer success. and you will be able to get it with a discount. Alexandros' second question, what do you said as far as clinical practice is concerned? You mentioned that the platform cannot replace a doctor. Is that because it cannot take such a type of responsibilities regarding the legal frame, or it has for each patient, or the guidelines and the informations are not up to date and they're only for academic purposes? Well, it's the first one. So, you know, not any single medical education platform can say, okay, we are as good as the doctor. This is not how, you know, me as a doctor, you as a medical student, we should always encourage patients to seek professional medical help. And obviously, Amboss is a great tool for the doctors to learn from. But, you know, especially with the AI, integration, I personally think that there is still a little bit of time until we give the wheel to the AI, and then we only as doctors go through it to review it. But yes, this is definitely because of the legal framework, not because of the up-to-date information. As you have seen in majority of the clinical and preclinical articles, they are reviewed every single day, because this is why we have the editorial team of more than 100 physicians that go through them. They review if it's up to date, they update wherever relevant, so that this information, you know, it's not like your standard book that, you know, from 2010 you would use the same book and nothing is going to change in it until you get a new one. So yes, it's because of the legal framework in this case. Yes, also we'll be happy to talk to you in person. So if there are no further questions, I think that we are right on time, which is brilliant. And thank you so much for the questions. And maybe Maria, now the word to you.
I think you have one more question in the chat. I don't know if you have already seen this. By Styliani. Did you answer it earlier?
Okay, so here, no, I have not. We have to sign up, so we have to be new members in order to get it. Do we get it even if you log in with your account? Yes, if you already have your account, you can get if we're talking about, the discount, you can get the discount if you already have the account. But again, only if, let's say, it's monthly, as I also told the person who asked about this, if it's going to your current monthly account, if it's going to expire in the next couple of days, weeks, you will be still able to get the discounted version, as I mentioned. But if you're unsure, just drop me an email and tell me when your discount is ending, and I'll try to navigate you how you could you know, either get reimbursed or purchase with the discount if there is a chance.
Okay, thank you so much, Thomas, for all this. Now, we have mentioned in the Instagram, you know, campaign, we'll give 1 year free subscription. So I'll send the link. It's like a Google form, nothing special. And you can fill this for about 3 or 4 minutes. I say 3 or 4 minutes so you don't spread it outside of this webinar. So you have pretty good chances of getting this discount full for a whole year with QBank questions inside. I'll do the giveaway soon. I think tomorrow we will. The lucky person will know who they are, and you also have you have help with starting your account, etc. So thank you so much, Thomas. Whether you win this giveaway or not, I'm talking to my fellow medical students. I think it's a very good opportunity. Amboss is amazing. I always wanted to be part of it, of getting into the platform. I always admired it, and I will, obviously. I'm not already in. And I think we're done. If we don't have any other questions, again, thank you so much, Thomas, for this webinar. And have a nice Saturday night, I guess.
Yes, thank you.
Are.
Thank you very much, Maria, and thank you for everyone who joined, and thank you for the questions. And again, if you are in Athens or in Patras during those dates, I think also Maria will share this information eventually. Once we finalize the Athens workshop, you can just go and say hi to my colleagues. They are lovely, and you can just grab some stuff. But don't tell them that I sent you there to just grab some stuff. All right, and also enjoy the rest of the weekend. And again, if you have any questions, just email me here at tps@amboss.com. And that's everything from my side. So take care. Bye-bye.
Thank you. Bye.